Hi, I'm Dr. Keith Baird, a clinical psychologist in Northern Illinois, and I'm here to talk to you today about some exciting developments in healthcare that we are a part of to make changes in the healthcare system. Now, most of us realize that the healthcare system as it exists in the United States today, it simply has to change. Healthcare costs in the United States go up higher and faster than anywhere else in the world. Already, healthcare is way too expensive for too many people in our country, and the way we're going, it's going to be beyond the reach of more and more people unless something changes. Efforts to reduce healthcare costs involve educating healthcare providers to think differently, to be thinking more about wellness and prevention, and ultimately to be willing to have different incentives in how they are paid. But making changes in healthcare is complicated. There are multiple opposing forces, whether that be the consumer, the healthcare company, the provider, or the hospital, all have different incentives that motivate them. So changes have to occur that appeal to all of these competing and sometimes opposing interests. I'm here to introduce you to behavioral care management, not only a new company, but a new type of healthcare business. We have two very lofty goals. One is to reduce healthcare costs, and the second goal is to do so while actually improving the health of the lives that we are responsible for. If you're a consumer, good health is more than simply going to your doctor for office visits, taking medication, or even getting procedures if you need them. Good health is also about changing the way that you behave to promote health and wellness. If you're a primary care doctor, you already know that more than half the visits to your office every year are for patients who have medical diagnoses that have a primary behavioral component. Type 2 diabetes, high cholesterol, hypertension, anxiety, stress, depression, smoking, drinking. Patients come to you over and over again with these medical diagnoses, and yet you know that rarely do any of these patients see a behavioral care specialist. Behavioral care management is poised to deploy our behavioral care specialists to work in your office alongside of you to help introduce these behavioral strategies to those patients. If you're a behavioral care professional, whether you're a psychiatrist, a psychologist, a social worker, or a licensed counselor, we would like you to consider being a provider for behavioral care management. We can offer you contracts in the new healthcare system to allow you to provide not only the fine traditional mental health services that you already provide now, but to also use you to help provide wellness services and prevention services to the lives of the people we're responsible for. We would also like you to participate as an integrated behavioral care provider to work alongside the primary care doctors to help promote wellness with those patients that have the medical diagnoses that have a behavioral component. If you're an insurance company or one of the new accountable care organizations, Behavioral Care Management wants to be your behavioral care provider. We see the big picture. We know that we need to lower healthcare costs and raise health standards. We know this has to be done with prevention work and wellness work. We know that we have to lower healthcare costs and keep the healthcare parameters up where they need to be. An example of how we could do this is with our new early bird scheduling software. Every year we see patients hospitalized for mental health reasons that could have been prevented had the primary care doctor or even the emergency room physician had more real-time access to a qualified mental health specialist. With early bird scheduling software, that doctor, even in the emergency room, would be able to schedule an appointment with a patient in crisis in a matter of an hour or two within a mile or so of that office with one of our behavioral care providers. We believe that with this real-time access, we can avoid some of these inpatient hospital stays, managing the patient on an outpatient basis more effectively, lowering healthcare costs, and improving the quality of their life in the process. If you'd like to learn more about behavioral care management, whether you're a consumer, a primary care doctor, a behavioral care specialist, or an insurance company, or maybe you would be interested in investing in behavioral care management, please look us up on our website at www.behavioralcaremanagement.com. And finally, thanks for watching.